And so I felt that it was important that we understand what is the problem here in our county and how can we try to address it, not just from the prosecution point of view, but from a prevention point of view. I looked at January 2020 to the end of 2020, and we saw that we had 88 fentanyl deaths, which is a large number. And compared to our homicide rate last year was 119. And then this year, just in the first several months up till the July 21st when we were collecting the data, we have seen now 52 fentanyl deaths compared to 62. That number, 62 homicides, that number fluctuates and it's almost even. The total number in this time period is 140 ones. And I think what we came away from was the magnitude of the problem and the critical nature of us trying to flood our community with prevention, because we will not prosecute our way out of this problem ever. We just simply will not. And we don't have the tools to do that as well. If you look at the image on the right, it shows you it's very, very difficult for anybody to understand the difference between a real pill and a fake pill. Okay, what are we doing as first responders? What are we doing to try to track the data? I had a lot of questions in my head, you know, what's happening at the hospitals, what's happening on the streets. And it's not a criticism, it's just that it seems that we're all still catching up on what do we need to do, because while we have 140 deaths, we don't know, I don't believe, and maybe Dr. Cathari or Dr. Quist can tell us, I don't think we're tracking near deaths. And that's really a healthcare system. You know, if I had, you know, the power one day, I would probably ask that we were, you know, when we have child abuse or domestic violence and that presents itself to our healthcare systems, there is a mandatory reporting system that's in place so we can understand the problem and follow through with that. We do not have that with fentanyl overdoses, or as far as I know, any types of near-death overdoses. People think it's Percocet, or they think it's Adderall, they think it's Xanax, and in fact, it's straight fentanyl in many of those cases. So part of what we're doing in the courtroom, and this is, many DA's offices across the state are doing this. Many of these people pushing these pills may not know that they're pushing fentanyl. There's an area of law called implied malice under the murder theory that you have to know what you're doing is dangerous to be held accountable. And so providing that notice advisement in a courtroom where a judge tells you, you sold fentanyl, if you do it again and you kill somebody, you can be held accountable under that, what we call implied malice.
Got it. Thank you.
Okay. So
I think that's the hardest part.
I will say this, when we talk about the kind of the community outreach plan, we've had great conversations with the Department of Health Services. We met with them. I think we are very much in the industry of collaborating, and we know that we cannot do this alone, and we need to all work together. They have a great, obviously, the SAC Opioid Coalition that they've been working on for many years, and we've asked to have members of our office join that coalition. In terms of what are we doing, I'm going to be bold and just say we've asked some of the ARP money. We did create a website that hopefully we can put all our resources into one. It's called onepillcankillsac.com.
Fire Chief Walt White, and as a first responder, I have witnessed firsthand the impacts of overdose. Where are people getting drugs? If they cannot get a prescription, they'll resort to seeking medication from family members, friends, or out on the street.
Also, the follow-up reporting, is there a way we can create an ordinance or whatever that would require the follow-up reporting on fentanyl deaths or near
like
deaths?
A local ordinance?
Near deaths. Yeah, is that what you were talking about?
Yes, I think I've had some conversations with folks from UC Davis. Again, the public health probably has the greater relationships, but I do think understanding the problem needs us to track the data. It also would help law enforcement. The part of that.
Thank you, District Attorney. You mentioned NORCAN. Of the 7 jurisdictions in Sacramento County, how many have adopted use of that?
I don't know the answer to that question. I do think that it would be a valuable conversation for this county and our community to talk about doing Narcan giveaways.
Yeah.
That's how, I mean, my colleague in San Diego was doing it this weekend in combination with public health and AMR, where they're actually giving. It's not a difficult thing. It's not an addictive thing. These guys are far better experts to talk about that, but I do think.
Anne Marie will be here, making her pitch again, I'm sure, because of, how strongly she feels about it, and those in the law enforcement community and people. So when will we see the opportunity? Because we've had other people inquire about that, and, you're going to bring broad categories, but some of this will be a backdrop to how we might categorize some of those dollars, so.
Yes, so we intend to bring the categories to you in mid-September after the budget hearings, and then it will probably be shortly, well, not completely shortly, but October.
Because if the answer is no, then it presents, certainly within the context of the full budget discussion, it presents the opportunity for us to do it there and or to wait until October when we know we're going to have a significant sum of money that we're going to be discussing.
I think the best approach is don't use street drugs because you don't know what's in them.
That's a really good point, Diane. Thank you so much for bringing that up. Thank you.
Are there any conversations around harm reduction approach? According to evidence-based interventions, fear and shame is not the way to try to combat substance use. We want to make people feel heard, inclusive, and valued.